bariatric procedures could be really categorized into two categories. And essentially they lay on a spectrum. So we have restrictive or purely restrictive procedures, and the idea behind those is that they restrict the number of calories that you can eat, and thus by restricting the calories you lose weight. These could be things like the adjustable gastric band, the intragastric balloon, which is on one side of the spectrum. As you move up and essentially the surgery becomes more effective at losing weight, you have a combination of procedures which combines restrictive as well as malabsorptive. So on that end of the spectrum would be something like a Roux-en-Y gastric bypass or something like a duodenal switch. As you move from the restrictive procedures to the restrictive and malabsorptive procedures, the weight loss or the effectiveness of these surgeries become much better. So the weight loss will obviously be far more enhanced. The changes are significant. And the way I actually get this is directly from my patients, direct feedback from the patients. Things that are simple to maybe, to you and I, like tying your shoes. My patients tell me they were not able to do that.
I have been obese for the majority of my life. Starting probably in second grade is when you can really see the difference between me and other classmates. I didn't have the tools that I needed to be able to maintain weight loss because I was not educated in how to do that for myself. So by the time I graduated from college, started my career, I have a desk job, I'm an accountant, a CPA. My first busy season, I think I gained 40 pounds. I gained 40 pounds sitting for the CPA exam. So 10 years out from high school, I find myself 150 pounds heavier than when I graduated. There are things that I limited myself and stopped myself from doing because I was overweight that I never even realized I was stopping myself from doing until I look back now. So I wouldn't get on a roller coaster. I would never consider kayaking. I did not like going to the gym because I thought everyone was looking at me. At 28 years old, there are parts on your body that should not be hurting, like your knees and your back. I was in pain all the time and didn't know it because it was just all that I knew. Once I lost 160 pounds, start walking around thinking, I feel great. I can walk upstairs and my knees don't hurt. I kayak, I go to the gym, I have a personal trainer, I've been to Dollywood, I've ridden roller coasters. I rode my first roller coaster in December of this year since high school. I will say that the biggest change in having the surgery for me has been an increase in confidence for myself. And it spills over into all aspects of my life. When you feel good about yourself, I think that it shines through and people gravitate towards people that they think are happy with themselves. When someone approaches me who is struggling and wants to know what they can do, the first thing I would say is don't try to do it by yourself. Because I got trapped into that cycle of thinking this is entirely me and it's my responsibility to figure out how to get myself out of where I am. And there's definitely nothing wrong with reaching out for help. My family, I think, is completely blown away by the physical transformation and also the mental transformation. I can show them pictures from 2 years ago or 2+ years ago of what I looked like, and my mom will say, that's unreal. I don't remember you like that. And I've had a lot of people tell me, I don't remember you like that. And when I would look at pictures of myself back then, I would feel like it didn't look like me, that it didn't represent who I was. Now I feel like I finally represent who I always knew I was. I look like how I thought I looked in my mind, if that makes sense. And so my family now just, my mom gets really excited when she hears that someone is going to look into weight loss surgery or have weight loss surgery. It's motivated other members of my family to have the surgery. My husband is planning to have the surgery this year with Dr. DePerry. And overall, it has changed my relationships with friends. I do more, I'm more active. It's changed my relationship with my family. We find more activities to do together that don't involve buffets. So there's just been a lot of changes overall, but I think everyone is happy to see me happy and is happy to see me thriving and healthy.
All my life, I was just obese. It is a genetic problem. Both of my parents were obese, my grandparents, and so it's just kind of, unfortunately, a common thing that we had to deal with. I was very active and I ate healthy and I was captain of my dance team in high school, but at the same time, I was 277 pounds. But at the time, that didn't seem like a problem. But I do remember speaking with my doctor and he said, you know, if you don't get a handle on this when you're 30, you can have type 2 diabetes, you can have hypertension. That's not really something you want to deal with in your 20s and 30s. You just see yourself become healthier and you see yourself be able to do more things, like I could exercise longer. One of the biggest things for my mom was she was able to fit into an airplane seat without having to ask for an extension. And that was just a moment in her life that was very beautiful and meaningful to her. Physically, you're gonna look different, you're going to lose weight, and you're gonna be healthier, but you also have the mental things that come with it. So improved self-confidence, you might be able to, you might feel like you can go out and do more. People are just happy for you. Now I'm a registered dietitian nutritionist and I'll be the bariatric navigator at Memorial Satilla Health. So what that means is I'll be educating future patients who are undergoing bariatric surgery. I will be teaching them an education class to let them know everything that they need to know before surgery, during surgery, the first little bit, and lifelong behavior modifications. I have personal experience in and then professional as I learned about it in school. As I did my internship, I got to visit a couple of bariatric centers. So I always knew that this was something that I just really wanted to do. I felt like it was somewhere I needed to be. As someone who has undergone the surgery, I can 100% say that it was the best thing I ever did. And I feel like I really succeeded because I had support in my life. I had wonderful dietitians, I had people rooting for me, and I want to be that person for patients as well. I want to guide them and I want to educate them, but I also want them to know that I'm here for them as well, as a friend, as a colleague who's had weight loss surgery. I know what it's like. If you're considering having surgery, definitely do the online seminar, learn about it, and meet with the surgeon. They are happy to discuss it. They can make it individualized to what you're looking for. So I think just jump into it. I know it might seem scary, but if you can watch the seminar, if you can do some research, if you can ask people who've had it before, that can really help you determine if this is the right move for you.
It's just seeing the patient happy and happy to have lost weight, happy to get rid of some of the medications they were taking, and happy to be able to play with their grandchildren and tie their shoes and sit in a normal chair. It encompasses everything, and it happens relatively quickly, and so it's very satisfying to see patients. Morbidly obese morbid is the Latin term for deadly, so it's deadly obesity, and from a number standpoint, it would be a body mass index of over 35 with certain comorbidities, which are diseases that are exacerbated or made worse by obesity or a BMI over 40. Extremely common in the obese patient, heart disease, high cholesterol, type 2 diabetes, sleep apnea. All of these we would consider the comorbidities that I spoke about, and all are impacted by weight loss. The adjustable gastric band is the procedure we do the least of. It tends to have the most difficult time for patients in losing weight after surgery. Cons would be a slow weight loss. It can take upwards of 3 to 4 years to lose all of your weight, and requires a little more discipline than the other procedures in terms of your diet and dietary habits after surgery.
A vertical sleeve gastrectomy is a restrictive procedure. However, it also has hormonal effect. by the way we actually manipulate the anatomy of the body. Anytime we perform a stapling procedure, which is what sleeve gastrectomy would be, then we have some immediate complications and we have also some long-term complications. So some of the immediate complications would be things like bleeding, because anytime we suture, what we call resect, or we cut an organ, we risk obviously bleeding. There's also a risk that anytime that we staple any organ, the staple line may actually fail. And so you may actually have a leak, which is probably what people have heard of. We have become very good at actually dealing with all of these complications. And our supportive treatment has made this procedure very safe.
Vertical sleeve is similar in nature to a band in that it's a restrictive procedure. It relies on the pylorus, which is a little muscle at the end of your stomach, to empty the stomach, whereas the band is sort of converting your stomach into an hourglass where there's no activity within the band. Your pylorus tends to close up and keep that food in the stomach until it's churned up enough to be able to be absorbed, and then it will relax and let the food go on by. Biliopancreatic diversion with duodenal switch is the most complex operation we do, and it relies on malabsorption or lack of absorption of what you're eating for your weight loss. It has the greatest long-term success rate in terms of losing weight and keeping it off, especially for the group of patients we would call the super obese, or those with a body mass index over 50. The rate of weight regain with that procedure is only about 1.5%. But with complexity comes a little bit more work and dedication in terms of adherence to a proper diet and a vitamin protocol afterwards.
So the biliopancreatic diversion really lays on the other end of the spectrum. It's a very powerful tool with regards to weight loss. Again, the immediate complications are the same because it's a stapled procedure, and it's also a malabsorptive procedure because we're rerouting the small intestine. So there is a risk of bleeding, there is a risk of infection, and at the same time, there's a risk of staple line failure. Again, those are the immediate risks. And for most of these risks, we will control them in the operating room, as in we will never leave the operating room without having a perfect operation, essentially. Should these complications occur, again, we have actually really developed a huge arsenal of interventions that we can control all of these complications should they occur. The other risk of biliopancreatic procedure, and is specific to it, is actually malnutrition. Because we're causing malabsorption of the gastrointestinal tract, then the risk of having low proteins and also not being able to absorb enough calories is there, which means you really have to be very compliant. You must keep all your appointments with your clinician, particularly your surgeon and your dietitian, so that we can monitor the level of your vitamins, as well as seeing your overall physical ability and making sure that you're meeting your micro and macronutrient requirements.
All of our patients that we operate on get put on a vitamin regimen. And so they all take vitamins, calcium, B12 supplements, and we depend on them to do that. So in terms of dedication, they come to the program knowing that's going to be part of what their post-op care is.
The gastric bypass is in the middle. And as we go from the sleeve to the duodenal switch, the weight loss is going to be greater. So that's why you get, an increased risk of having nutritional deficiencies. Again, the way we control this is by keeping a close eye on our patients and making sure that they see us and they see our dietitian to make sure that they're actually meeting their micro and macronutrient requirements.
Oftentimes, patients think the surgery is the be-all, end-all. Although surgery is a huge, big deal, it's only part of the process. There's education that goes on, psychiatric care that goes on, support groups, all in an effort to help the patient through the process so they can have a successful outcome.